Hi, welcome to Ames Responds to COVID-19, a question and answer program where Ames area organizations respond to your COVID-19 questions. I'm Susan Guiasa, the Public Relations Officer with the City of Ames. On today's show, my guests are Dr. Alex Ramirez, Professor of Veterinary Diagnostic and Preventative Medicine and Faculty Advisor for ISU's Public Health Team. We also have Stephanie Downs, Wellbeing Coordinator with Iowa State University's Human Resources Department and co-chair of Healthiest Ames. And we have Andrea Cardenas, Health Promotion Coordinator with the City of Ames and member of Healthiest Ames as well. Welcome to the program, everyone.
Thank you.
We will start right in with our questions. Dr. Ramirez, tell us a little bit about your connection to ISU's Public Health Team. How did you get involved?
Yes, thank you. Thank you for the opportunity to be with you all. So I am a veterinarian. I have training on infectious diseases, obviously, but also have training in public health and disease transmission and work quite extensively on diagnostics. So some of those skills as the university was looking on deciding the testing for students arriving, as well as how to interpret data, I've been kind of helping provide advice on how to interpret data and how to maybe do the next testing phases.
Okay. Iowa State has seen a decline in the number of positive test results since the start of the semester. What's the university's strategy for testing, and what do the results mean for campus and the community?
Yeah, so yes, we're glad to see those numbers go down. I think, it's always about what do the numbers really mean. And what we've been focused here in the past few weeks has been on targeted testing. So we're really looking for those who are most likely to be positive, and then also testing those around them to make sure that transmission is not occurring. So we do expect to get positives because that's who we're targeting, but we always like those numbers. The lower, makes us feel that there's less maybe transmission occurring. So we're happy with those numbers. Looking into the future, we're trying to still continue to figure out what's our best approach to mitigate some of those risks, not only for the Ames community, but also our faculty and staff. So we're looking at everyone, and we're keeping those options open. At this time, we're still doing some targeted testing, and we're looking as access and time provides us opportunities to maybe expand that greater to targeted testing of more specific groups based on where we see risks could be maybe a little bit higher.
Well, it's good that the numbers are going down. We're going to switch gears here and go to Andrea for a little bit. As our health promotion coordinator here at the City of Ames, you work as a contact tracer for City of Ames employees. Andrea, what are you seeing in the organization, and how are the numbers that you're looking at?
Right, so we developed an in-house program for contact tracing so that we can more quickly respond if we have someone who tests positive for COVID-19 and identify who's potentially exposed and make sure that they quarantine or isolate as quickly as possible. And what we're really seeing is a couple things. Our numbers are reflected in what's happening in the community. So when we have a community outbreak, we're also having a larger outbreak within our employee population. We're also seeing that our preventative practices are working well. So that means that people are not coming in when they're sick, if they're staying 6 feet or farther, when they're wearing a mask, and they're following all those preventative practices. We're not seeing spread of the illness from employee to employee. People are getting COVID-19 and they're from their households, from family members, from roommates, but they're not getting it at work. And so that tells us that those preventative practices are effective, and want to make sure that we're continuing to follow those.
Well, that's good news for employees. Of course, we want to see the numbers down to nothing, but it is encouraging that you're seeing that the tactics are working. Thanks, Andrea. Lots of people have been affected by COVID-19 in Ames, including our local schools. Besides Iowa State University, our elementary and secondary schools have had to restructure their learning models, limit the number of students in facilities, practice social distancing, and incorporate face coverings into everything that they do. Our guest, Stephanie Downs, serves as co-chair of the Healthiest Ames organization, a nonprofit volunteer group focused on maximizing the health of Ames residents. This group saw the need to help the Ames Community School District and launched an ambitious face coverings project. Stephanie, tell us a little bit more about that project.
Yeah, thank you, Susan. So we, with the board, want to reach out and support the community. And one of our board members who works closely with the schools offered to reach out to the Ames Community School and see if there were ways that we could support. And so through conversation with their committee, there was definitely a need for masks for the students coming back to the Ames Community Schools. So the idea kind of launched, and I have to give credit to Gail Johnson and Ann Thompson. They really were the champions of our project, members on the board that really kept it going.
So Andrea, I understand you are also a member of Healthiest Ames, and we're involved in this project. How is this face covering project funded?
Right, so we put a request out to the community to help support our project, both in terms of volunteering hours of time sewing or helping organize, as well as financial donations. And the Ames community really responded. We had over $3,000 just in individual donations of people that donated $25 or $50, whatever amount they could give, and another $5,000 in donations from community partners. So we were really pleasantly surprised and also happy to see that kind of support with the Ames community just really rallied around this project and really supported it.
Okay, Stephanie, tell us a little bit more about what was the ultimate goal of the face coverings project with the Ames Community School District.
Yeah, so initially our goal was to provide 5,000 masks to the students at Ames Community Schools with a stretch goal of maybe 10,000 if we could get there. And with all the donations, with all the support, the community coming together from everything we did, we were able to offer 12,800 masks went to the schools, the Ames Community Schools. And a little over 3,000 of those, I think, were actually purchased. So again, over 9,000 masks were really sewn by 177 sewers in our community. We had students from the kinesiology club at Iowa State that helped package them, volunteers, especially retirees in the community that wanted to really pitch in and help out in some way during this time period. So really donations that came in, as Andrea mentioned, from all over, and a lot of collaboration between Mary Greeley and McFarland for their expertise in helping us with what the masks should be, laundering, making sure that they were really ready for the students.
And so now those have been distributed to students?
Those were all distributed prior to the first day that Ames went back on their 50, kind of their hybrid model. And the teachers, they've been packaged up by the rooms, by the number of students, and the teachers were providing those out to all the students who were needing them. So every student in the elementary ages got 4 masks. 3 were sewn, 1 was the purchased one or commercial made, and then the high school, middle school all received 3. So a lot of options. So when they wear out, they get tired of them, they've got some additional ones. And we have about 2,000 extra right now that are still to be distributed, and we're going to continue to take donations. We still need those. We know that the need for masks is going to continue beyond now. Once students are back full-time, there'll be even a greater demand. So we'll continue to try and provide those as much as possible.
So we all know that face coverings are one of the 4 pillars of healthy behavior that are suggested in the Cyclones Care public health campaign. That is, wear a face covering, stay home if you're sick, wash your hands frequently, and physical or social distance 6 feet or greater. This sounds like a great project that supports Cyclones Care. Just as a closing remarks, anybody have any final thoughts on face coverings? Because that's a popular topic in Ames these days, and you are all health people. So let's close it out with just a few words of wisdom. We'll start with Andrea. Anything that you could encourage Ames residents to do to help during this time?
Yeah, I think the thing that's really helped when I'm talking to our workforce is just reminding people that you can be around somebody that has COVID-19 and not get it if you're both wearing masks. And just yesterday, the Iowa Department of Public Health changed their recommendations as far as exposure. So if both parties are wearing a mask and are closer than 6 feet for more than 15 minutes, it's not considered an exposure because those masks really are effective at preventing the spread of the virus that causes COVID-19.
Okay, Stephanie, any words of wisdom?
We're in the process of providing flu shots and encouraging everybody to get a flu shot with this potential twindemic. But in addition to that, some of the nurses, their wisdom was just this: protect yourself, but protect others. The masks aren't worn just for you. They're also worn to protect everyone else and sometimes those innocent bystanders of grandparents and others who are in a higher risk category. So wear masks. It's for the betterment of our community, and we really appreciate the support.
Okay, and Dr. Ramirez, any final words?
Yeah, exact same thing, right? We have two things, face coverings and distancing, and we have full control over those. So we have a choice, right? We can protect ourselves and protect others by just doing two simple things. Wear face coverings and keep that physical distancing.
Great. Thank you all for being our guests today on Ames Responds. Remember, Ames Responds is an opportunity for Ames residents to ask their COVID-19 questions. If there's something that you would like to know about, let us know. We can put it together on our next program. Send us an email at covid19@cityofames.org. Thanks for watching.